Good afternoon, good evening, and good morning, because we are on all different time zones. And welcome to the 14th episode of Genomics Gupshup. This is where we have conversations with experts who can help us understand and simplify the world of genomics that we live in. Today we have a very, very special guest, someone who's very dear to me, someone who I truly, truly admire, and somebody who has really changed the world the way we see it. I'd like to welcome Sharon Terry, who's the CEO of Genetic Alliance and has a very, very interesting history behind everything that she does. So welcome, Sharon, and I'm so honored to have you on our show.
Well, thank you, Anna. Anu, it's a delight and an honor to be on your show.
Thank you, and it was wonderful to see you again after many years, and it's fantastic, all the things that you've been doing. So before I get there, I know your background is very interesting. I think you did you were in pastoral studies or theology and all of that. So how did you enter the world of genomics? I get asked this question often. How did you move from physics to genomics? So maybe can we start with that first? How did you enter this world of genomics?
Yeah, sure. Thank you. And then as you did your intro, I thought, oh, making the world of genomics understandable by ordinary people. I'm actually good because I'm an ordinary person. I have no medical or scientific background. So my children were diagnosed with genetic disease after what's called a diagnostic odyssey. It shouldn't have that name because it's not a fun thing. But essentially of not being diagnosed after several years, I did get a diagnosis for them. And when I did, I became overwhelmed with what could happen to them. This condition called pseudoxanthoma elasticum, we just say PXE for short, could cause legal blindness and vascular disease, and certainly caused a lot of skin manifestations. And so I was terrified with a then 5-year-old and 7-year-old to be facing this. And so what I did was I put together a research consortium, and I borrowed lab space from Harvard and built a biobank and found the gene and built a registry and all these things that were important in the scientific realm, but sort of got catapulted from being a college chaplain and a stay-at-home mom homeschooling my kids into this world that I didn't know anything about.
You made it all sound so simple. Then I borrowed some lab space, and I found the gene. I mean, I'm sure it was a lot more. And I think for those of you who haven't watched Sharon's TED Talk from a few years ago, I think maybe it'll help you understand this in a lot more detail. So I think from PXE, which I saw that you mentioned about the OMAs in that, right? When you were first given that name, I think it's difficult for an average person to understand all these complex names. I think PXE sounds easier to understand, but I think when you open up the names of most of medical terms, I think it's a little bit harder. And I think one of the things I'm trying to see is, can we break it down and see if they're easier to understand for people? But from PXE, you then went on to becoming the CEO of Genetic Alliance. I think that's when I first met you several years ago. I think now more than, I'm thinking when, 2007.
Yeah,
so a long time back. So how did that transition happen from PXE to Genetic Alliance?
Yeah, that's a great question. So as I started to build biobanks and registries and all these complicated pieces that were needed in order to advance research, I think in the age of COVID, we all have a better sense that you need a large group of people and you need to do all kinds of testing on them and you need to get the regulatory folks involved and so on. What happened was lots of other parents came to my house and said, can you help me do the same thing? And I, at first, yes, I sat on the couch and I told them what I had done. And then we realized very quickly that that was not scalable, and that I was really interested all my life pretty much in stuff being scalable, industrialized, and so on. things like I had taken the Massachusetts Home Learning Association, which was a group of us homeschoolers, and then made it national so that the whole nation's homeschoolers could talk to each other and so on. Anyway, Genetic Alliance was already in existence. I happened to go to the 10th anniversary of Genetic Alliance, a celebration during which the founder was stepping down. I met Francis Collins, who is a special advisor to the president now, was the director of NIH, and just met a lot of really good people and started to work with Genetic Alliance because I realized they're already an umbrella group of all of the advocacy groups internationally, in fact, and there would be a great place to start to deploy these ideas I had and get people to be able to work with each other. And so I first served on the board, late 90s, and then 2004 became the CEO of Genetic Alliance and have served in this position since.
Yeah, I remember I came to one of the celebration. Now I'm trying to think whether that was the 20th or
I think it was. Yeah, I think you were there for the 20th. Yeah. And, you know, we thought it was great that we had made it that far. And now we're on our 36th anniversary this year. So we've come a long way. Yeah.
That's amazing. So I know that, you know, there were many different groups within, like communities within Genetic Alliance. And I do remember that when we were at GeneLogic, we were looking at a lot of the biobanks. But how many are there now? I mean, that has been also a few years since we last, you know, were in touch in terms of how many number of communities that are there. And even at that point, it was so many communities, so you were serving so many different small, rare disease groups that it's amazing. But maybe if you can help us understand, you know, how many of those groups currently exist.
Yeah, so that's a great question. And it's an interesting question you ask right now because I'm going to say something I haven't yet said anywhere. And that is that I think in those early years, there were hundreds of us rare disease groups. And the genome itself wasn't sequenced until 1999, 2000. So people didn't know how many diseases are there. If there's 20,000 something genes, you know, are there that many diseases? It turns out there's somewhere around 7,000 rare diseases. And we've now, as a society globally, identified most of those in some form or another. And of those, there are communities built around many of them. So I would say we're up to somewhere around 2,000, 2,500 groups. And the other really big shift, and the part that I haven't really spoken publicly about, is when I was doing this, you needed to form a 501c3 and get a board of directors and do this all in a very formal way. 501c3 is the NGO status in the US, and there's different ones in different countries. But now what we're finding is that these social gathering spaces like Facebook, and certainly some of the other apps that are more prevalent in other countries, WhatsApp and so on, are places where these groups of people are gathering. And sometimes it's only 2 or 3 families that have a unique mutation that their kids share what's called a phenotype, meaning there's some difference in the disease manifestations. And so we're not limiting ourselves anymore to these sophisticated NGOs, and they still exist and they're important, but we're also saying if people can come together socially in some of these more modern ways and not have the encumbrance of fundraising and audits and bookkeeping and all that, then that's great. And let's catapult them into research in a much more quick and facile way than we did years ago. So I think it's a pretty exciting time. And I think we're probably looking at 10,000 groups that are possible for us to interact with these days in different ways that help each other. And we really want to encourage this network learning, like let's learn from each other and not have this be a centralized behemoth by any means.
And so for and I know that you do get communities are global, but if you know, maybe if there are viewers from India who are watching, and you know, I know that many people have reached out to you as well. I mean, at least through me. I mean, a couple of people that recently also reached out. But how do people actually find their way to sort of be a part of this community? They go to the Genetic Alliance page and contact you and form the communities, right? Or
Yes, yes. So we encourage them to come to geneticalliance.org, or my email is very easy. It's sharon@geneticalliance.org. And I actually triage hundreds of these emails a month with new families with new conditions wanting to find support. And if we know about support, so we run a directory called diseaseinfosearch.org, and in there are all these communities listed. So if there's support already, that's great. And if there's not, we have a whole menu of activities, a map essentially, of how do I go from just being mom and dad to actually getting research done on my disease. And I'd say particularly for India, there's more recently a lot of sophistication around the fact that support is helpful. There's a number of Indian umbrella rare disease groups that have been very helpful to Indian communities. And then certainly the work that you're doing, because if we can raise the literacy level of the public so that the public understands genetics, genomics, these are important parts of our lives, then I think when a kid gets sick or when even an adult has a genetic disease, there's more support in the society understanding this is a critical piece for us to address.
That's fantastic. And I know one thing that really caught my attention in your TED talk was that when you said that we had someone come and collect blood, and then the next set of researchers came in, and then you found out that they don't share information. Over the last many years, I think, do you think that has changed tremendously, or there is still work to be done?
Yeah, there's still work to be done. I think that especially in health and medicine, and probably even a lot of the sciences, at least in the biological sciences, it's really slow to get new paradigms to be understood. I mean, I think what you've done is extremely brave to, take and make this accessible to the public is just unheard of and still avant-garde in a way. In other industries, that probably would be much faster and well accepted, like ride sharing or music sharing or whatever else.
Right.
So we get it in those realms. I think when we get to health and medicine, we have the ivory towers of the universities that are entrenched and really wanting to keep what they consider gold is data from people who are sick. I think that's unconscionable and unethical. And exactly when our children had these people come one day and take their blood, and 2 days later another group try to take their blood, I thought if the average person knew that there's so much competition and that in fact instead data should be like air. There's plenty of it. I can take as much air as I want and I don't hurt you by it. The same thing with data. There's plenty of it. And if we especially keep it in the hands of the people and the people decide what's going to happen with it, and we're not selling it like some oil or gold, then I think we're going to get much farther, much faster. I have a firm belief that if universities, for example, all threw their doors open worldwide and shared what they had, we would accelerate the advance toward understanding Alzheimer's and Parkinson's and lots and lots of things, diabetes, stuff that we really need to understand. And instead, we're trying to stay with these commercial interests. And sometimes people blame companies. I tend to blame, if we're going to blame anybody, and I try not to, but I think the universities have created this self-interest that's more entrenched than I find with companies. So, examples are when you were running GeneLogic and Asamum in the US and India, for us, your attitude toward sharing, your attitude toward supporting a nonprofit that was trying to share was so much more refreshing. And I find that with a lot of companies that they're really interested in, let's not have the nonsense of blocking up all this data, let's share it, because there's so much more to do, and the competition can happen when I'm bringing a drug to market or when I'm bringing a product to market. It doesn't have to happen with the raw material, the air, essentially.
Yeah, I think, and people forget that, all of us can be, might all have, something that we will benefit from if we all were able to do that, right? So I think newer models are coming up now in terms of just how we can share this data. But I think we still have a long way to go. But what you do at Genetic Alliance, for instance, putting that biobank and, some of those aspects, I think were absolutely fantastic. You also put that, I remember the whole, the sharing, the private access and other layers on top of that. So I think it is, you've thought about a lot of this much before everybody else was doing it, in terms of, how do you get people and communities together? How do you share data and all of that? So I think one must commend, all the work that you've done and then what the number of people you have impacted. So I'm assuming that, 7,000 rare diseases approximately. You said about 10,000 communities, and I'm sure that millions and millions of people have benefited from something like this. So I think putting together that consortium, what you did, is a need of the world, and I think rare diseases are not that rare, right? I mean,
right? We're finding, what is it they're saying, 1 in 10 people, some 250 million people in the world. There's been a lot of attention to infectious disease, and so some infectious diseases are more under control these days, and inherited diseases, rare diseases don't get that attention. And so while each one is rare, it's true that they together are quite common. And the other thing I'll point out is, and this is a little difficult to understand for the layperson, but as we know, breast cancer is not just breast cancer. It's 500 kinds of breast cancer. Or, an easy way I think to understand this is, two neighbors have arthritis, a drug works in one, it doesn't work in the other. That's because the background genomes are different, or the genomics of the particular arthritis are different. So we're not only going to have rare diseases, the classical ones, monogenic, just caused by one gene, but we're going to have a lot of stratification for all of us around genetics, genomics, and that's going to be critical that we understand what is our genome contributing, and also our environment and our lifestyle and all those other pieces.
That's amazing, because I think part of at least what we are doing at Mapmygenome is trying to understand complex and other diseases as well. So we talked about researchers, clinicians, the ones that need this information in many ways to diagnose or others. Do you think that they are much more evolved now over the last few years, given the amount of information, new information that has been passed on to them, right? Because clearly, I think this is not something that is part of your, at least in India, is not that much part of your medical curriculum. And I'm sure that, for the clinicians that have been around for longer, even in the US and others, I don't think that they were also exposed to that. So do you think that clinicians are really appreciating this whole wealth of genetic information that's coming in, or is it a bit much information for them as well, right?
Yeah. So, I think that they're appreciating it more. You're right, and it's true in the US and Europe too, that there's just not enough genetics training. However, I think we're going to find easy ways to integrate this information so that they don't have to become geneticists, essentially, to be a pediatrician or to be a rheumatologist, but they'll understand that there's an important impact here of the genetics, and good decision-making tools and good interpretation, those things will really help to guide the clinicians. I think the other thing that I like to think about is not creating a huge workforce worldwide of geneticists and genetic counselors. And my friends who are both are probably going to throw rocks or tomatoes or something at me. But what I think is that the other specialists can learn to use the tools. Just like I don't know what it was like when radiology came in, for example, but I imagine that we thought we had to have very specialized individuals read those radiographs, and we do, and we have them. But the average doc who's treating a kid with a broken leg can look at it too and say, here's what needs to happen next. And I think we can get there with genetics as well.
So I think, you're right. I think a lot of, until the average clinician can learn to interpret a regular report, genetic report, I think we will not see as much, penetration across the market, right? And we've started seeing that with oncologists, with some of the OBGYNs, at least in India, we see a lot of that. People who are neurologists have gotten, they see value in it and they can understand what is going on. And yes, we need genetic counselors to explain specific, details and explain to families and all of that. But you're right. I think when we can make reports that are easy for people to understand, especially clinicians, I think that's when we will see, like you said, can someone look at a radiology report and understand what is going on. I think that's the key. I think that's a very great way of putting it, right? We'll be able to get many more people to understand.
Yep.
So let's move on to your new and very exciting project that you're doing. Can you talk to us about what you're doing at iHope?
Yeah. So excited to talk to you about iHope Genetic Health, a name which we picked to say that we can bring hope to a certain number of individuals in the world who number in the millions and millions. And those are the people who have an undiagnosed disease. And so all of us know someone who says, my child is just not thriving, or my child's having seizures, or this person, it doesn't seem developmentally to be moving on. Or adults too, that all of a sudden seem to have some symptoms we don't understand. And so what our project is doing is to take all the undiagnosed that we can find and bring them to a diagnosis. And to do that, we're going to need to use very advanced genomic sequencing, something called whole genome sequencing. The entire genome will get sequenced. We'll need those kinds of interpretation we just talked about. So somebody reading the genome and then writing a report from it and diagnosing especially children, but also adults who are undiagnosed. The point being that an undiagnosed individual costs the system, the society, a lot of anguish and a lot of money. So it's in the political interest of countries and societies and communities to be able to diagnose people earlier so they're not disabled. Lots of disability comes from undiagnosed genetic disease, blindness and inability to walk, and certainly the inability to be a productive member of society. And so what has happened is we've gotten this phenomenal grant from Illumina, which is a sequencing company, and Illumina gave us $120 million in instruments and chemicals called reagents. Not any money, so if there's any donors that want to give us operating money, we need that. But we have this phenomenal asset. And then Amazon Web Services gave us storage capacity for especially to increase health equity. So the idea that low to moderate income countries like India don't have the same advantage that the high income countries do, like the US and like countries in Europe. And it is critical that we apply these really amazing technologies to these countries and allow the same kinds of insights, the same kinds of advances to occur. And so what we will be doing is finding in-country labs, because we also don't want to be this kind of, come from the US or have everyone come to the US, but instead, how do we build in-country capacity in places like India, Africa, Southeast Asia, and Latin America, so that in the country, the geneticists, the pediatricians, the rheumatologists, the obstetricians can do the work right there and diagnose people quicker, faster, and in our case for free, because we're going to give away all of this resource so that that can be done quickly.
I think this is an absolutely outstanding project, and probably the one of its kind which has a global footprint. And so I think, it's something that, if people who are watching and there are philanthropists and also people who might just feel that this is an important, project that they want to be associated with, I think we should reach out to Sharon. I think she's given her email on sharon@geneticalliance.com, right?
.org. Yep.
.org. Yes, sorry.
Yep.
So you can write to her and see if there is any way that you can be a part of this, whether it is in terms of contributions, financially or otherwise. I think it'll be great if all of us can help and grow this project that you have, because I think it'll have long-lasting impact. It's not an easy thing to do, but it is something that I think will be truly. I think the future generations are going to help us. And I think your cat, she
wants to get in the act too.
Yeah, she's saying me too.
Right, exactly. She's volunteering.
Yes,
yeah.
So she's volunteering. I think others should too.
Yes, and I think the other thing, Anu, that's amazing globally about this program is that we are partnering with a company called Luna. They have enabled, empowered, unleashed the power of people owning and controlling their own data. And so they provide this platform that we can register the people who are coming into this I Hope Genetic Health. Then those people get to decide, will my data be used for research? Do I want more done here or not? Which is fine either way. And then scientists can come and look at these data, and the data is living. We call it a data stream with Luna because it's always being added to. The families can add more information. The families can say, here's what we're really living with. Here's the lived experience of my kid and my family about this disease. And we're going to much more quickly come to even solutions that are not necessarily drugs that cost $1 billion to create, but in fact, ways that I can deal with the disease because you taught me something about you, the way you live with the disease, and we'll be able to get those solutions much faster. So we're thrilled with this partnership with Luna as well, that we get to be able to work with people day to day in communities, and that they can actually control what's happening with their own information.
So I think you've done what no one else does, which is putting, big instrument vendors like Illumina, AWS, companies that are helping the federated, in some ways, form of data sharing and putting together communities and everybody else together. So I think hats off to you. I think you've done something that no one else has been able to accomplish. So congratulations on that. And I'm sure that this project is really going to make a big difference to the world. So do you think that there is anything else from, that we could do, both, from the genomics community as well as otherwise? If there's something else we can do to change the current state of affairs, of course, what you're doing is probably going to make the biggest difference, but are there other things that you feel that that we can do to improve the literacy of genomics, or anything else that you feel that can help in making this a better place for us to all live in?
Yeah, so I'm really interested in how you have been able to leapfrog some of the problems that we had in the U.S. around the sort of patriarchy of the clinical community, saying only we should understand this, because you're absolutely right. It's the literacy level of the society that probably will actually dictate how far those clinicians can go, how far the scientists can go, and how fast, because public support and so on is going to be, it's going to be absolutely necessary that happen. And so when I think about companies like yours, and in even the way that all along as a company you've been, whichever company you're with, you really did model collaborativeness. You enabled our biobank all those years ago, and without it, we would, not be able to do what we were doing and be able to store samples the way we did and track them and so forth. So I think in addition to the genomics and, certainly improving the technology and the readouts and all that stuff, the idea that we all take a hard look at our own companies, at our own self, and say, where is it that I could give a little more? And I don't even mean like burn myself out, because I think we've all been burned out in COVID big time, but more, is there something that I can just take a little fence or a little wall down a bit and share a bit more, because we'll get places faster? And that's when I think the public starts to see, oh, this is not a field that's out to make a buck. This is a field that actually wants to make difference in people's lives, and that's going to be much more appealing to the public than what we've seen about the reputation of a pharmaceutical company, for example, or even some governments that hold data in hostage, essentially. So I think that's going to be really critical. The other thing I feel very strongly is that we've got to stop the models where we say everybody in the country has to go to a specific academic medical center or to a specific center. It's great to have the wonderful expertise in those places, but I think we have to go to where people eat, work, pray, play, and be in the communities with the people. And until we understand that, kind of, again, back to this sort of, other industries have distributed themselves so that I have in my pocket a way to play a song and share it with you. is meant that somebody understood that I don't want to be, going to a big box store and buying something and bringing it somewhere. And so I think we need the same thing in health and medicine, that in the communities, in the towns, in the villages, we really need to be serving the people right where they are and not putting the burden on them to get themselves somewhere else to get the services they need.
Yeah, I know that. I think that's also part of it, is also that we need to educate the community. And I remember, for instance, we ship out kits, but for some of the people, when I talked to them, they said, one day when we come to your lab, we will be able to do this. And I said, you don't need to. I think we need to help people understand that, a lot of this can be done, where you are, sitting where you are. And I think I like that, where you said we should go to where people are in terms of the community, where they eat, where they pray, and where they live. And I think that's when we'll be seeing a lot more integration of these communities into the advances that are happening in the genomics world.
Yes.
So Sharon, is there anything else that you would like to tell us that maybe I have skipped, or something that maybe other than, of course, I would like again to remind people that it would be nice, while everything else is good, I think there is also a need to fund projects like this. But is there any other thing that you feel that we've missed out in our conversation?
No, I mean, I think what I would say to the public is that while genomics, genetics is new, we all know that now we're using these words at least pretty commonly. I think I was, finally with the pandemic lifting some of the constraints. I was in, a fast food restaurant on a trip, and heard like a plumber saying to another plumber, "I just had my genome sequenced." It's like, oh my goodness. So I think if we can come to some kind of comfort about this, that it is something that should be accessible, and you're certainly making it with Mapmygenome very accessible, that will really make a big difference. And I think the other thing I want to say is we're looking for ways to make all of this less expensive. I mean, for the general public, they might not know it cost $1 billion and 10 years to get a genome, and I'm sure I don't have the numbers exactly right, but now that you can do that in a couple of days for, several $100s or $1,000 or whatever, is much, much less expensive. And that we're able to leverage enormous amounts of good technology and good understanding. And that kind of brings me back around to your gracious statement around, if there are philanthropists who think that this might be useful, because what we're not doing is we're not building a big, huge enterprise at Genetic Alliance, and that we're keeping this lean and mean. We're looking for small amounts of money that will leverage huge amounts of money. We have a saying that what we want to do is shut the lights off and go home, meaning we did our job. We're not interested in sustaining our organization for the sake of the organization. We really want to make a difference in people's lives. And so I think anybody who wants to get on board with that in any way is really critical. And we definitely look forward to working with you. It is delightful to think about working with you again, because we both have fun and get good stuff done.
Absolutely. I think we can and we will. I think that is, so I think the whole concept of I hope is something that, the moment I found out, I think I was so excited about, what we can do with I hope, that I hope that other people also understand and want to be part of this. So it has been, as usual, delightful to chat with you, and I hope you learned a new word. Gupshup means chit chat or a conversation.
Yeah, I like that a lot. I looked it up when you invited me, and I said, yeah, that's a great word. It sounds like it. So, yeah.
Because I think one of the things was that we do a lot of talks, and all of us are part of like a lot of technical discussions. But I wanted to have a series where we could have a chat and a conversation, and sometimes we can talk about cats participating in volunteering and things like that. So the little bit of gupshup and make it simplify it so that everybody can sort of be a part of the conversation. So thank you again. You are an absolute inspiration, and it's always delightful to chat with you. And and the impact you've made in the world. I hope that you can continue to see that hope multiplied by several times. So thank you once again, and I hope to see you again very soon, and this time hopefully in India.
Yes, wonderful. Thank you so much, Anu, and thanks for your good work.